my friends. I'm back again Saturday, August 12th, 2023, in Ottawa, Ontario. And I took a walk in the rain and was going back in time about my triumph over powerful painkillers back in 2017. Okay, let's start from what happened. On Christmas Eve 2017, I had severe stomach pains. Well, it was actually 2 days before, which I initially thought was just routine food poisoning. However, by Christmas Eve, symptoms did not pass. My stomach was distended horribly. The pain would not go away. So I basically called the ambulance and ended up at the hospital, where I found out I had to have emergency surgery for a blockage in my intestine. On Christmas Eve 2017. What a way to spend Christmas, huh? But it saved my life. Anyways, had emergency surgery Christmas Eve evening back in 2017. It turned out that my intestine was not only blocked, but it twisted upon itself in a knot. So it saved my life. They had to undo the knot of my intestine, and I had to stay in the hospital for a week, basically. A tube was painfully inserted in my nose down my esophagus to my stomach, and I could not eat any food, drink any water, except suck on ice cubes, until my body gradually recovered from the surgery. And that was an emergency surgery, and it was a serious surgery. Anyways, as I slowly adjusted to the going back to eating regularly, slowly but surely, within a week, I was eventually discharged on New Year's Eve, where I got my phone from the pawn shop at the time after, and I got things done totally on super high opioid painkillers after the surgery, which of course I needed, of course, that's natural. And they were very highly addictive as well. Now, I knew about addiction to pills and painkillers before that, I remember. So I did not become addicted to these pain meds, which so many people I knew before have unfortunately become addicted to. Now, this may have not helped in my alcohol problem thereafter, but my personal method of not getting addicted to opioids, painkillers, was I took it in the daytime, and I waited about 2 to 3 hours after the pain med wore off. Then I went straight to drinking red wine, usually about a liter, so I don't feel the pain of that either until I've passed out. And then in the morning, I would take the opioid painkiller again, wait 2 3 hours again in the evening for it to wear off, and take the red wine again. That kind of worked for the opioid pain addiction. I did not even finish the pain meds, actually. I did not finish the pills at all. I did not finish the whole bottle. Hence, I did not become addicted to the opioid painkillers. Unfortunately, in my case, it opened up a new door to a new problem with alcohol. I was drinking a bottle of red wine almost every day, about a liter, I say. At the time, I did not know there was so much sugar in these wines I was drinking at the time. And as a result, the next day after, my blood pressure would shoot up. I would get dizzy, have panic attacks, not feel well, and then drink more wine to compensate for the panic attacks and the high blood pressure, which did not help at all. I went to the doctor, and My blood pressure was going up and down. But of course, since the surgery too, and the red wine with the sugar, that did not help as well. This was back in 2017 after Christmas. So I didn't know about the blood sugar affecting blood pressure next day in red wine. It took me maybe about a year or so after that to learn that. And I became strict about checking the blood sugar levels in wine. Eventually, I did cut down the wine. Somewhere along the, and then I got myself back on track, slowly but surely. I got a good lucrative job there a couple of years ago for over a year. My drinking went down to once or twice a week. And that's when Joe's neighbors started blubbering and complaining and bad mouthing me. I could hear her ranting and raving and crying about me, a bunch of guys in her place when I came home from work several times when I was working steadily. Plain and simple jealousy. That's it, that's all. Vindictive behavior, jealousy, which eventually was my demise. And I cut down the wine drinking big time. Right now, I haven't drank any wine at all, hardly. And if I do, I learned mixing wine and beer is not a good combination. I got so sick, ended up in the hospital, and I'm 51 years old now. I cannot do that. It's no wonder I'm in the hospital with these severe traumatized induced relapses. And they are traumatized induced since my assault from the other neighbor last year, and the harassment over the years, and the assault from the other neighbor who's blubbering away, and she assaulted me and hit me in the head with big bruise here. Went to the hospital for that back then, and the bus driver intercepted me, and I was unconscious outside my apartment quite a few years ago, and she admitted she assaulted me. Violence, trauma. But anyways, yeah, it's really tough. I guess that's why it hit me so hard why he is seeing her, obviously. Why see someone who assaulted me so badly and is violent and bad-mouthing me, and someone who will very probably be his demise in drugs again, if so. But yeah. It's been a long struggle with alcohol since that surgery. That's my personal story, how I overcame the opioid painkiller addiction, which unfortunately led to problems with more alcohol. Unfortunately. But on the bright side, I'm not addicted to alcohol and opioids, just the alcohol. Beer and red wine were my catalysts. 40% alcohol when I was younger, yeah, but that was a long time ago. And if I have that now, I'd be dead. I end up in the hospital. I don't want anything over 40%. I don't want red wine anymore, except maybe one glass, with dinner. And honestly speaking, I'm on my big beer today after a whole week of abstinence. The whole key is to drink in moderation and so forth. Alcoholism is a self-diagnosed disease. And I'm just so happy that I never got addicted to opioid painkillers after my surgery. But of course, it did not help my alcohol problem at the time as well. And yeah, sugar, I have to be careful of sugar because that could be a problem, make you sick the next day for a lot of people. You never know. And yeah, those people not affected with sugary alcoholic drinks, good for them. But be careful. They already get more riskier for high blood sugar problems, pre-diabetes, and diabetes. So be careful. And if you get a red wine, check the sugar content. Guys, if you have a date with a girl, check the sugar content of the wine. Make sure it's not too high. Make sure it's low, and just make sure they have no pre-existing medical conditions that sugar may affect their health. So yeah, even beer is risky because the liver converts the alcohol into sugar and everything in your bloodstream, carbohydrates and all that. So depending on the beer, it all depends. Unfortunately, with beer, you cannot tell what the blood sugar level is in a beer, like wine and Irish cream too. They have you can see that in the labels underneath the shelves at LCBO and Wine Rack. If you want to know the blood content level, if you're confused, ask the sales associate and so forth, and have them recommend something for you low in sugar, if you're concerned about sugar. But yeah, um, that's my personal story how I overcame the opioid painkiller crisis, well, addiction. But it didn't really help with my alcohol problem. And I'm so glad I do not drink like some people here. How can there's a woman? There's one of my neighbors here loves her rum. Ugh, I cannot drink that. Ugh, just makes me sick thinking about it. Ugh. I can't handle that. It's just too strong. There are some people who drink like 20 beers a day. I don't know how they do it. Right now, my maximum is today's. I had two already today, to be honest, and this is my third one. That's it for me, and that's fine by me. And I do not appreciate people who make slanderous remarks toward me when they don't know the story. It's racist too. And if it keeps up when I'm proving myself, that could be there could be some repercussions on their behavior for that. Just saying. But yeah, that's my story about how I managed to avoid the opioid addiction, painkiller addiction. Thank God. And it'd be interesting to know other people's stories, how they became addicted to what, and how they get affected when they don't have it. I talked to a few people already about um, their addictions and their withdrawals and their recovery and so forth. But it'd be interesting to find out these stories from people and so forth. I just don't like the drug pushers who try to get the drugs on youth or today's youth and everything. I mean, come on, this girl who's 20 years old sees these people who are like 50, late 40s and 60-year-old. And this girl who's in her 20s sees someone who's 60. I mean, 20 something, 30, 40, 50, 60. That's almost a 40-year age gap. Why would someone in their 20s see someone in their 60s anyway, when they have a crack problem and drug problem and all this stuff and no good influences at all? I mean, come on. That is just plain sad and sick. That's just plain sick. Anyways, yeah. God knows what they're on, and it's not my business, but I know what they're on. But it's just sickening and saddening. And yeah, it's a crisis. And if you watch the Christine Lauratown channel, they try to get you purposely drugged up sneakily. They could do all kinds of things too. For instance, a neighbor, my ex best friend neighbor, did something sneaky to me years ago. I don't smoke crack. She told me to smoke a little pipe and claimed it was only weed. Whatever was in there, it was not weed. I smoked weed before, years ago. Whatever it was, my heart felt it was going to fly on my chest. I could not sleep. I almost called the ambulance at the time. I felt it was going to fly on my chest. Speed or crack or something, knowing that she's a crackhead anyway. What kind of person would do that? That is manipulative, that is very conniving, and that is someone deliberately trying to get someone addicted to drugs. Targeting youth like that, targeting people. Yes, even I was fooled by her charms and her niceness. But I see your true colors now. I see her true colors now, unfortunately. And if she was a good person, she would encourage you to stay off the drugs, not get into it more, and ban most people trying to help people off it. I mean, come on. It's just simple logic. But anyways, yeah. I'm just so glad I never got addicted to the opioids and everything and all that. And the other YouTuber mentioned that downtown there's somebody targeting some women in some areas, putting some white powdery stuff and offering soup and stuff to some people, and some white powdery stuff on their spoons, and that's going on downtown core right now as well. They're sneaky. They target you. They pretend to be your friend. They might give you soup or something and put something in it. Food, even the drinks and everything, all that apparently again. That's happening downtown. And I won't be surprised if these people cursing the kids are doing the same kind of method. God knows what kind of methods they're using. But yeah, I'm not going to trust anyone offer me anything. And you got to be very careful. And yeah, addiction is very serious, fast acting agent when it comes to drugs, especially. And the people trying to coerce people into drugs are very sneaky and very manipulative, and they know what they're doing. So people be careful out there. I'm so glad to say that I tossed out half the pill pain pills I was on after my surgery. I did not finish the pills. I never got addicted, and I pat myself in the back for that. Good for me. And if I can do it, you can do it too. One step at a time, get the help, and just be careful out there. Do a journal. Think. You got to use your head for these things. And yeah, if you resist help, you resist help. You get coerced, and that's it. That's all. So yeah, just be careful out there. Be aware of the addictions. Be aware of predatory people out there, manipulation, coercion from the drug pushers out there, and so forth. Keeping people away from people to help them. And yeah, that's the thing. Seems like it's going to be a rainy evening tonight. I'm not sure the fireworks are going to go on. I'm going to check the weather. I might go out and see if it's going to be on. If it's going to be really raining heavily and storming, I might not. I'm not sure. 50-50 chance I might go out. I don't know. It all depends on the weather, huh? So, yeah. So be careful, my friends. Stay safe. Take care. And, yeah, watch your backs. Have a great Saturday night. And talk to you soon.